All right, this is chapter 4 of our section on obstetrics, and we're looking at prenatal management of the normal pregnancy. We're going to start with diagnosis of pregnancy. This is a summary slide that we're going to look at again at the end just to show us where we're going. How do we usually diagnose pregnancy? The most common is looking at a beta-HCG. Now remember, beta-HCG is not diagnostic of pregnancy because you can have a beta-HCG because of an ovarian tumor. But most of the time if we have a beta-HCG, we say it is a pregnancy and we use that. Another way in the office, which is very easy to identify, is listen for fetal heart tones with a Doppler. Now I like to use an ultrasound because it not only tells us that there is in fact an intrauterine pregnancy, it tells us what is the gestational age, and it also tells us how many fetuses there are. Gestational age will be another issue that we're going to deal with the first prenatal visit. The most common method of assessing gestational age is by menstrual history. When is the last menstrual period? What is it like? Clinical landmarks we'll talk about. Again, early ultrasound is going to be an excellent way of addressing gestational age. We're going to look at risk factors, obstetrical risk factors, medical risk factors, sexual, family, social. All of these are going to impact on our patient. Laboratory tests and return visits we will talk about later on. Let's start with diagnosis of pregnancy. On the first prenatal visit, we've got to make sure that she is in fact pregnant. You need to know for the exam what are the signs of pregnancy. There are presumptive signs of pregnancy. These are unrelated to the uterus or the fetus, and they are not necessarily related to pregnancy, but you should always think, could the patient be pregnant? The most common of these is amenorrhea. What's the most common cause of secondary amenorrhea? Pregnancy, of course. In your notes, it lists some other presumptive ones, such as breast tenderness, nausea and vomiting, but probably the most common one that we use is amenorrhea. The probable signs of pregnancy are related to changes in the uterus, to the mother's feelings, or the biochemical parameters, but not necessarily related to the fetus. What's the most common reason for enlarged uterus? Pregnancy. Is every enlarged uterus pregnant? Not necessarily. You could have a leiomyoma, you could have adenomyosis. But that's certainly something that we need to think of. Beta-HCG is also a probable sign of pregnancy. It is not definitive because it can arise in conditions other than pregnancy. The definitive evidence of pregnancy is related to the fetus. And if one has objective means of assessing that the fetus is present, either with ultrasound visualization or hearing fetal heart tones, which are different from and separate from the mother, that's going to be definitive. Now, in years past, an X-ray, which showed a fetal skeleton, would be definitive. But we don't use that anymore because we have the ready and easy availability of ultrasound. Here is ultrasound evidence of a pregnancy. And you've seen this picture before. Beautiful picture. Here we can see a nice profile of the first trimester fetus. This is the mandible, this is the maxilla. Great diagnosis of pregnancy. In the second trimester, we not only look at the presence of a fetus, but we measure the head, the biparietal diameter. And that's going to be a good evidence of gestational age. This happens to be 24 weeks and 6 days. That's the end of diagnosis of pregnancy.